Good morning, Bridge Dental Podcast listeners. I'm here with Dr. Britany Baker. Dr. Britany, how are you?
I'm doing great. How are you?
I'm doing fantastic. Thanks for joining us today. We really appreciate it on an early Monday morning. And we're going to get going today. Dr. Britany Baker is going to share a lot about self-care, mental health, oral health, and really her just kicking butt in the dentistry world about 4 years out from dental school. So for all the Bridge Dental Podcast listeners, you're in store for a great treat. Dr. Baker, I want to kick it over to you. So introduce yourself to the Bridge Dental Podcast listeners.
Hello, everybody. So my name's Britany. I graduated back in 2020 from University of Kentucky. I'm also from Kentucky. I currently live in Charlotte, North Carolina, where I am an associate in a private practice. I've been there for 4 years. It's been my only job. I love it there. I plan on staying for pretty much forever. I have a social media presence. I get on Instagram. I like to post a lot just about like my day, just like what I'm up to, what it's like, being a dentist and things like that. Just things that I go through. And yeah, I'm really happy to be here today.
Well, Britany, appreciate you kind of landing the plane for us. And I want to dive into the, being an associate and how much you love it and like the experience you're going through, because we're so used to getting on this podcast and people are like, I'm going to buy 1, 2, 3, 4 practices. And like, so we're going to dive deep into that. But how did you get into dentistry in the first place? What motivated you? What drove you down that road?
Sure. So my mom is a dental hygienist. She went to dental hygiene school when I was probably like 2 or 3 years old. So from a young age, I have these memories of her just like studying and like kicking butt at the kitchen table, doing what she had to do. Growing up, I would ride the bus to her dental office that she worked in. She worked at the same place for like 20 years. So I just kind of grew up around dentistry. Ever since I was a little kid, like my mom's been my hero. So I was always like, I want to be a dentist. I think when I was a little kid, I thought my mom was a dentist. I was a little confused, but that's what I always said that I wanted to do. And so for some reason, like I just never really changed my mind. Nothing ever really enticed me or anything. So I just kept on going for my dream of becoming a dentist. And here I am.
I love that. So you ended up, now you get to school, you go to Kentucky and kind of like take us through a quick version of what school is like for you.
Yeah. So in my I'm telling you, I knew I wanted to be a dentist since I was like probably like in preschool. So that
Awesome.
kind of brainwashed me throughout my entire like school experience. Like I think that I lived in fear. I was kind of just like, oh my God, if I get in trouble, then I'm not going to get to be a dentist. So like in high school and things like that, like I never really like got into any trouble. I was a good kid. Whenever I went to college, I was crazy. Like I was in the library every single day. And things I just worked really, really, really hard and things, came not really easy to me, but I was used to working hard and getting rewarded for my hard work. When I got to dental school, things changed.
Okay.
Things got a lot harder, obviously. I was used to getting all A's, and just doing really well. But when I got to dental school, I struggled a lot. I went through some burnout. I kind of developed some anxiety, some depression, some things like that. So I kind of started struggling with my mental health in dental school initially is where that kind of all began for me. Dental school was really, really hard. It was a really good time because I got to meet a lot of really awesome people. And obviously I was pursuing my dream. But at the same time, it was some of the hardest years of my life. And I came from some really dark places coming out of dental school. And so that's one of the reasons why now I'm really passionate about my mental health and not getting burnt out and just talking about vulnerable things that we all kind of go through in this field.
Sure.
Yeah. So that's kind of
Where did you go to dental school?
I went to Kentucky, the University of Kentucky. So in Kentucky, we have 2 dental schools. We have Kentucky and we have Louisville. I had done like two or three, well, actually two summer programs through U of L, just like mental kind of things. And then I ended up going to Kentucky, both really, really good schools. We're lucky to have both of the schools in our state.
Very cool. And so when you were going through or prior to dental school, you had this experience where it was put in the work, reward driven, and you get to dental school and that algorithm changes a bit, which leads to, I don't know if you want, like, if I could describe it as self-doubt, would you self-defeated thinking or whatever?
Yeah, a
Okay.
lot talking mean to myself, talking down to myself. That was
Sure.
kind of my motivating factor. Like that's the thing that really motivated me. All going through school, I'd be like, "You're dumb. You got to work harder." In my head, be like, "You got to do this. You got to do that. Like that's not good enough. That's not good enough." But I try just a little bit harder, and I get that reward. Now, obviously, whenever you get into professional school, things are a lot harder than
Sure.
they were undergrad, and I don't think that I was really expecting how hard it was going to be, and not really only how hard it was, but also you got to think you're taking like double the amount of credit hours that
Sure.
you have ever taken. So it's just a lot to manage and get used to for a lot of us.
And I feel like, and you could share more on this, but I feel like when you're going through that experience, you feel alone, right? I'm on an island. No one feels this way. It's just me, which only adds to the anxiety or overwhelming experience. What was that something you dealt with? How did you come through that
Yeah, there
experience?
was a lot of shame involved during those times. And I think that's one thing that a lot of us kind of deal with whenever we're going through times of self doubt. We're having a hard time, so we're going to beat ourselves up. I think that it's a shameful thing, and that's how it was for me. And because of that shame, I didn't want to share with anybody else. I didn't want anybody to know what I was going through because I was embarrassed. And I was like, well, if they know that, then they'll think that I'm stupid. Like, they'll know the truth that I'm dumb and like I shouldn't be here, like
Right.
really kind of terrible things to be telling yourself, especially whenever you are working towards being in a position where you really need to exude that confidence and that leadership and things like that. So it was really tough, just like self-doubt, a lot of
Sure.
confidence issues and things. But once you're in that place where it's like rock bottom and you feel all alone, I feel like that's a lot of people have to reach that place, that rock bottom place where you
Yeah.
just feel so terrible in order to reach out for help. And that's kind of what happened to me. Whenever I was in school, like I failed some tests. There was a test that I had failed that I had studied really hard for. I can't remember what class it even was, but I just remember failing this test. And I went down to like the guidance counselor at dental school and basically just like lost my mind, had like a mental breakdown. And on that day, she actually sent me to talk to a therapist, like an emergency counseling session. And I had never done therapy before. I was very new to kind of all of that mental health, like talking about anything. And I basically went and spilled my guts to this lady. And it was really the first time I had ever like opened up about the way I had been feeling, about how I had doubted myself so much. I just felt really stupid. I had like imposter syndrome really
Sure.
bad. And it was so eye opening and almost healing to just like say it. Like nobody knew how I felt. Not even my mom, like my boyfriend, not my closest friends knew how I felt. But once I did start sharing with my friends and things like that, I found out that a lot of us were feeling the same way, and a
Sure.
lot were afraid to talk about it.
Yeah. It takes an incredible amount of courage to one, talk about it to somebody at all, and two, then to overcome it, share it. Like, hey, are you guys dealing with this too? Because it's almost like you don't want the pressure of like people seeing you that way.
Yeah.
So that takes an incredible amount of courage. I give you a lot of credit for that. Now, one of your passions is self care and avoiding the burnout, and so I'm assuming this came from your dental school experience and even today. So how have you tracked through that today into more of like the positive moments and making sure you don't burn out in self-care? What are some key things you're doing?
I think honestly, keeping things into perspective. I think that in the beginning of my career and also in dental school, whenever a small thing would happen or, go unexpectedly or the way that, went wrong, I would turn that into a humongous problem in my head and also make it about myself. So
Sure.
I think keeping things in perspective, like it's not about me, that's one thing that I have to tell myself all the time is it's not about me. It's not about me. It's not about me. Because I think that a lot of people who do struggle with confidence and things like that, it's like you do blame yourself for a lot of things that happen in your life. So just being mindful, keeping things in perspective, doing things like yoga, journaling. I do therapy. Every week I do therapy. I talk to a therapist. And for me, like that is so vital. Like I
Mm-hmm.
think that for me, I'm the kind of person who's just going to be in therapy for the rest of my life.
Sure.
Just having another person to kind of talk to about things like an unbiased opinion and things like that, just helping me kind of make sense and navigate my world. Also just like having friends who are also going through the same kind of stuff that you're going through. So you know that you're not crazy. Also, like I know that a lot of the struggles that dentists and people in the dental world have are kind of unique or they feel unique, but
Right.
they're actually not. A lot of people in a lot of different fields go through the same thing. Like one of my really good friends is a hairdresser and she goes through some of the same exact feelings that I go through, just like being hard on herself or like if somebody's hair doesn't turn out exactly like she was planning, she's very disappointed, you know what I'm saying? So
Sure.
a lot of people in different fields, like if you work with, people, then you're going to feel a lot of the feelings that I'm talking about.
Have you, and I love what you're working on, and it seems like a form of exercise, journaling, talking to people. And was that something, it started from the guidance counselor, but was that something you've taken over as like post graduation to be very intentional about?
Yeah, because when I was in school, I had that really one conversation with a therapist, but I didn't really have any others. Like I'd never been going to therapy. I'd never done all of this stuff. But then once I kind of got out of school and I started seeing a therapist regularly, that kind of helps me stay on track and be intentional. Like you have to be intentional a lot of the time. And now that I have been working on myself and I know myself a lot, it's like I can almost anticipate the way that I'm going to feel. Like, for example, the other day, like I had just a terrible day and I posted about it on Instagram. I was crying and stuff like that. And I knew how I felt on the drive home. And I knew that 3 years ago, if I would have came home feeling like that, what I would have done is I would have like ordered Taco Bell on Uber Eats. I would have laid down in front of the couch and I probably would have fallen asleep on the couch at like 7 p.m., woke up at like 4 a.m. and like just felt terrible. You know what I mean? Like that's
Sure.
just not the way to do it. So now what I do, it's kind of, I call it the force yourself method. And so it's kind of like you got to act like a robot sometimes, right? Like you
Sure.
don't to
Yeah.
do certain things, but with self-care especially, you have to do that. You have to use the force yourself method because why are you doing self-care? It's probably because you're not feeling so great, right? So if you're not feeling great, then you're not motivated to take care of yourself. So you have to know in your head, like, okay, I'm going through a time where I don't feel too good, but I know that if I get up and I do this thing, then I'm going to feel a lot better. So that's another, you got to be really intentional and you have to just move your body because
Right.
a lot of the time mood follows action. That's one of the mantras that I live by is just like do something and then see how you feel. Don't wait on your mood to change and then do the thing.
Mm, mood, mood.
Yeah.
I love that.
Mood follows action.
Yeah, that's right. You're in a sense forcing yourself, but it's because you've understand how you're wired now.
Yeah.
And right, you don't want to wire to Taco Bell all the time, so you you wire yourself to some different actions. I love that, and then your
Exactly.
mood changes.
Hmm.
Um, I love that. So bringing us to dentistry, and you're very passionate about oral health too.
Yeah.
And tell us about how you like to work with patients. Is there a particular part of dentistry that you're really falling in love with? You're 4 years out from, being graduated. And so I'm sure you've learned a lot of different processes and different techniques. And what are you finding that you're passionate about?
That's a really good question. I think that I have found things that I don't like as
Okay.
much as I thought I was going to like them. But at the same time, I don't want to write them off, if that makes sense. Like one thing that happened to me whenever I first graduated is I said, I don't like kids. I don't want to work on kids, period. And my boss is also my mentor, and he like had a conversation with me. He's like, Britany, like, I know you don't want to see kids, and like that's totally understandable. But it's kind of like whenever you're talking to a little kid and you're like, okay, you have to try it before you don't like it. You know what I mean? You have to give it a try. So I'm like, okay, fine, I'll give it a try. So I start seeing more kids, and now I love to see kids. Like one thing that I thought I was going to love whenever I came out of school was cosmetics. I took on a couple cosmetic cases. Turns out it's not actually what I like to do.
Okay.
I really like to do like more functional work. I like to replace teeth that are missing, help people get function back. I think that down the road, I will, kind of divert to more nuanced things like cosmetics. But for right now, I really just like general dentistry. I like kind of being able to be that person who can do a lot of procedures. I like for my patients to not have to go to a specialist for every single thing that they. I like to do my own root canals if I can. I like to place my own dental implants if I can. Obviously I know my limitations, but also I kind of want to be that provider that can kind of do everything.
Sure.
So that's kind of what I'm working on right now. I do a lot of Invisalign cases. That's one thing that I've really fallen in love with. One thing, like if you're a dentist, like you don't like to take away natural tooth structure if you don't have to. So Invisalign has really been one of my favorite procedures to do because you can take what somebody already has and then just kind of make it better, if that makes sense. Renovate it, get it into a good and stable position. And a lot of times people will come to me being like, I want veneers, I want to do cosmetic like to my teeth. And I'm like, let's try Invisalign and whitening first. And then like a lot of the times they're amazed at just what they already have, how well it looks once it's in a better position. So I think I like that. I really like to work with anxious patients, patients who are really scared and who are like crying because of the needle and things like that. Like for some reason, I really like to work with those patients because I am that kind of patient whenever I go to get medical procedures done. And I just know kind of what they need more so than someone who's not anxious.
It sounds like to me, you like impactful work. Like when you could see the patient and you have impact on them, it seems to give you a lot of, strength, desire in those procedures.
Yeah. But, that's a superpower of mine, but it's also one of my weaknesses because I do get a lot of fulfillment out of my work that I do. But at the same time, I really tie myself to that. Like I take a lot of, like I think about it a lot. And if things don't go the way that I want them to go, if there's complication or something, I beat myself up about that. So it's a good thing, but also something that I'm trying to get a little bit more balanced.
Gotcha. And if you guys haven't given Dr. Baker a follow on Instagram, we'll put it in the show notes, but it's at peaceful.toothdoc, right? And so I was going through the videos and it's great. I mean, it is like this vlog or blog, whatever, right? And it's just like, I can relate and I see what you're going through that day, good, bad, ugly, it doesn't matter. Like I could just relate and it's a great outlet. And obviously based on your followers, like they're following through that. Are people giving you, I didn't go through comment sections, but are they giving you that type of feedback? Like, thanks for sharing this. And like, this is what I was feeling today, or I'll let you kind of share what type of feedback you're getting from it.
Yeah, but that's really, I get a lot of feedback of just like, oh my gosh, like I had the exact same feeling. Like I went through the exact same thing. And, I have people message me all the time, like in my DMs, just like, thank you so much for sharing and being vulnerable. And, as dentists, I think a lot of us feel the pressure to be perfect and to appear like, oh, it's just easy for us,
Hmm.
when in reality, I think a lot of us are very hard on ourselves, and kind of sharing the not so great moments along with the great moments is really important too, just to show that you're not alone.
Yeah, which Instagram can tend to do, right? It looks all pretty all the time. So,
Yeah.
but you never know, that video or thought that you share, how that it affects one person. So it's almost just as impactful as dentistry in a way, right? Like you never know how it affects somebody.
Yeah.
So you've been an associate for, I think you said 4 years now, same office, and tell us about that associate experience.
Yeah.
And it sounds like you have a mentor. So how you are connecting with the mentor, how you're growing your skill set as an associate. Talk to us a little bit about that.
Yeah. I mean, honestly, I could not have found a more perfect place for myself, to work. It has everything that I needed. I have autonomy. I treatment plan everything. I don't have somebody looking over my shoulder and questioning me. I've been allowed to grow and also ask for help whenever I need it. I do feel like I have literally the best team in the entire world. Like, I'm so, so lucky to be where I'm at. I know a lot of dentists have a dream of owning their own practice, owning multiple practices. I don't really know what I want to do yet.
Hmm.
I think that I want to be an owner. I think that I do. But for me right now, the thing that I have been focusing on for the past 4 years is legitimately just becoming a better dentist. And I think that one thing that can happen to people, and I mean, maybe everybody's different, but I know for me, I'm not good at multitasking.
Hmm.
I would become so overwhelmed if I was trying to be a new business owner and be a new dentist, manage staff, like all of that stuff. I like to be an associate for right now. And then maybe down the road, I just have my mind open. You know what I'm
Right.
saying? I don't like to kind of say, this is what I want to do. Like, I like to just do what I want to do, like in the moment. Also, I think that a lot of people forget like the benefit of having a mentor, of being an associate. You get to go in and we have all of this good technology. I have this mentor, I get to see how a business runs. Coming out of school, I had no clue. Like, I didn't know how dental insurance worked. Like, I did not know how the business ran. I did not know anything. And so I'm really lucky to be in a place where, somebody has literally showed me everything.
Hmm.
Um, I've seen a lot of people get screwed over. New grads. I don't know if I want to get into like the screwing over part. This is kind of a conversation.
Or
But
maybe they jump in, real fast, don't know
yeah,
the business side.
well, I was kind of getting I just know some people who've got taken advantage of, but I
Sure.
mean, I don't, yeah. But I really love where I'm at right now. And I think that I've learned a lot. And yeah.
With regards to being an associate and growing yourself through that, I mean, most people tend to just want to jump like from A to F. Like they just want to like, let's keep skipping these steps. You've
Yeah.
obviously you're getting a master's degree in the dentistry side and starting to see the ownership side. Is that accurate?
Yeah, exactly. Exactly. And it's really nice. Like, I get to sit down like once a week, me and my boss eat lunch together. Like, we will talk about anything. Like, we'll go over cases,
Okay.
like the numbers of the office if I'm wondering about something. Like, he's literally just taught me everything. Like, everything.
How did you get connected with this particular office? Did you bounce around for a minute before you found the right fit, or what was that like?
Yeah, that's a good question too. So I did tell you that I have only been in this one office since I
Sure.
graduated. So I work Tuesday to Friday, and on Mondays I'm off work. So for a little while I was doing temp work on Mondays. So I was kind of going around to different offices, bouncing
Okay.
around, seeing, what all was out there. Like, do I like where I'm at? You know what I mean? By bouncing around to a bunch of different offices, I learned that I really do like where I'm at. The way that I found my office was actually on Facebook. I was in dental school, and it was kind of crazy. It was like literally right before the pandemic. Like, I want to say it was December. It was winter break. So I got on Facebook. I got on like Charlotte, North Carolina Dental Connect or something, and I posted my picture. I'm like, I'm going to be a dentist. I'm not yet, but I'm going to be, and I'm going to move there. And I got, I think, 6 or 7 responses. And so I planned like a weekend or like a few days, like a Thursday and Friday, came down, did all my interviews and everything. And I was between 2 offices, and I ended up picking the one that I'm at right now. I feel like I had a really good kind of bunch to pick from. They were all very different. And I feel like I got to pick the one that was kind of right for me at the time. But it's really funny because I interviewed, and then I ended up signing my contract like right before COVID happened.
Oh my.
So I slid it in there. I'm just like, you can't get rid of me now.
I signed the contract already.
Yeah, exactly.
Talk about how you came through COVID, with dentistry. What was that experience like for you?
It was insane. Well, I mean, it was 4th year for me. So I was already done with like most of my requirements. So it didn't impact me as much as it impacted some of my classmates. So a lot of the requirements in dental school that you have to get, like if you're behind on your requirements, it doesn't necessarily mean you're slacking. It could mean that like your patient had to reschedule, or you couldn't find a patient who needed like so-and-so procedure. So some of my classmates ended up having to stay back an extra semester in order to the requirements, because people didn't want to come in. The biggest hurdle for me was really boards. I had to do a filling and a cleaning on a patient, and I had to pay my patient $500 to come to even get this done, because COVID had started by then. I hadn't touched a handpiece in, I think, 8 weeks when I did my boards. Yeah, because we couldn't go into the school. And so I was just literally sitting at home. And then one day we woke up and just like, okay, I guess we're taking boards today. We take boards. Thank God I passed the first time. Yeah, some people didn't pass, but that was really the biggest thing for me. Kind of a crazy thing, kind of random. Whenever I started seeing patients in private practice, I wore a mask always, because, N95, like you have to wear a mask. And so only like in 2023, I want to say back in like the winter, maybe, whenever we started not wearing masks, I had like a little bit of anxiety in not wearing a mask in front of my patient, because none of my patients had ever seen my face.
Oh my gosh.
Like ever. So it's like when I stopped wearing my mask, they're like, oh my God, that's what you look like. And I'm like, yeah, is it ugly? Is it like what you expected? But yeah, that was kind of weird too.
Just add to the anxiety pool. It's like people see
it's like kind of like my security blanket a little bit. I didn't even really realize. But then like we go to work one day and my boss is just like, okay, guys, like we don't have to wear masks anymore. And I'm just like, wait.
Do you, I'm curious, because just going through your Instagram and speaking with you today, you have this fun personality like that you use. I almost feel like you use humor with your patients. You're positive with your patients. Talk to me about how you get whether you're delivering a treatment plan or helping somebody, whether it's through the understanding of Invisalign, how do you deliver that message to, I don't want to say sell the treatment, but how are you delivering that message to make them feel comfortable so that they accept the treatment?
Yeah, that's a really, really good question. And I think that that's something that I'm still working on. I think it's something I kind of always actively be working on. But whenever I'm delivering a treatment plan, like what I want to convey is my vision of the end result. Like I envision what that person could look like how they could be functioning, how their oral health would change if they did pursue the treatment. And so I think that one way to really kind of get people to listen is to talk, and this sounds really weird, but is to talk about them specifically. And when I say specifically, I mean really, 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 really specifically. So like up pictures of their teeth and zooming in to the little micron of a chip that they have on their lateral incisor. You need to care about that. You know what I mean? You need to let the patient know that you see that. You know what I mean? And also asking them like what their vision is, like what are they trying to, achieve. And then also like just repeating back to them what they're saying to you, if that makes sense. And so really like whenever I'm delivering a treatment plan, it's not about me as much as it is about the individual patient who's sitting there, because each time I deliver a treatment plan, it's going to be different than the way I did it before, because every single person is different.
Absolutely. And do you feel like that's been a good fit for you? Is like, hey, here's kind of what I see for you specifically, Steve, and what are you feeling? Do you think this is the same thing you're seeing for yourself? Like you kind of combine the two visions, right?
Yeah, exactly. Like first I ask them like what they're wanting. And then if I see things that would kind of hinder us from achieving that, then I would address that first, right? And then I would just kind of talk through with them, to see what they think about what I think about how we can achieve the treatment plan. But also like sometimes you see patients who don't want to talk about it at all. Like they're just like, why are you sitting here explaining this to me? I need a crown. Okay, perfect. Fine. Where do I sign the paper? And you have to be able to read that, because I've had that before, like where I care way more about explaining it than they even care about listening to it. You know what I mean? And then I don't know, I just end up feeling like an asshole.
Right. It's like, in dentistry, did you imagine you'd get into sales, right? Because you gotta read people, adapt. That's essentially what it is at the moment. Yeah.
I used to cringe at that. Like whenever people would talk to me, like my mentors and things would say something about you have to sell the treatment, I would cringe, because I'm just like, I'm not selling treatment. I'm just treatment people need. But no, it doesn't matter if they need it, if they don't need it. You have to sell it to them, because the mouth is such a mysterious place. They don't know what's going on in there. Like it's literally up to me to tell them what's going on and convince them to do the treatment. Because I would say 80% of the time when I'm doing treatment on a tooth, that tooth is not bothering that person. You know what I mean? So that's kind of hard. Like I have to say, so you came in today with nothing bothering you. It's still not bothering you. I want you to give me $300 to do this. You know what I mean? It's like, I have to sell that.
Right. Yeah. But to avoid a disaster 5 years from now, we got to do this.
Yeah, exactly.
That I appreciate you sharing that. Dentistry can definitely be, you got to create urgency in any, role, especially and like you said, it's more of a need, but they don't even know. So you got to create that urgency, whether it's through the pictures that these new machines are taking. They're so detailed, and we never used to see that, 20 years ago, or at least I never saw pictures of my teeth.
Yeah,
like that.
I mean, even if they showed it to you, you're like, okay, like, what do you mean?
Right. Yes. And that's a play in its own. It's like, thanks for embarrassing me with my mouth photos. Like,
oh my gosh, I know. Like that's when I feel so bad. Sometimes I like pull up someone's picture of their tooth and they're like, oh, that's me. And I'm like, I'm sorry.
Well, so let's talk about this. So the vision for the patient, vision for themselves. What's the vision for Dr. Britany Baker? Like, where are we going next? What are you thinking about? What are you like? Where are you going?
Wow, what a question.
Loaded question.
Oh man. I think that every single day I just want to get better at doing dentistry. I just want to be a better dentist every single day. Like that is literally my vision. And I know that sounds so corny and everything, but honestly, it's been my dream my entire life to be a dentist, and I'm finally here. And I just literally want to get better and better and better and better. Like I just want to watch all kinds of CE courses and just get better at doing procedures. Like, I mean, as far as goals financially, like, I don't know, I want to save up for my retirement and things like that. But I'm not the kind of person who really I'm not the kind of person who's wanting more money. You know what I'm saying? I want money to take care of myself, and I don't want to worry about my bills and have to worry about, my life in the future and things like that. But really, like, I just want to enjoy my day, and I just want to be a good dentist and just keep on getting better.
Well, what are some ways that the people listening to this podcast should connect with you, whether it's just through via social media, if they direct message you? Like, what are ways where they can learn from Dr. Britany Baker?
Yeah, you can get on my Instagram at peaceful.toothdoc. I'm also on TikTok at the same handle. You can DM me, you can message me. I'm always in my DMs talking to people, like other dentists, dental assistant, dental hygienist, dental student, pre-dental student, whatever it may be. So yeah, get on there and we can chat it up.
And it seems like you have a passion to help. So,
I do.
Or, I don't know if I'm overstating that, but.
No, it's true.
Okay. Yeah, very cool. And I think if you're listening to this and you're a dentist who thought you were alone in that, I almost want to call it like a perfection, feeling.
Perfect.
Right?
Yeah.
There's a lot of you out there that are like that. You guys need to talk. You need to connect, right?
Yeah. Trauma bonding.
And the more that you can discover people who are thinking the same thing, you can also discover a way out of that stress. It's okay to want to be a perfectionist, but just the stress of like carrying that all the time. And
yeah. Also know that's a strength. Like you're reaching towards perfection, but that's a good thing, right?
Right.
Like you have that motivation to just try to be better and just don't talk negatively to yourself in your head, and that's it.
Right. Versus the strength being that I'm pursuing something, I want to be great at it, not it. The trial and error is the okay part. Like you're going to have some errors, right?
Yeah. Exactly.
Mood follows action. So if you're in a bad mood, change the action, right?
Period.
Period. All right. Well, Dr. Baker, I love that you came on. Any final message you want to leave to the Bridge Dental Podcast listeners?
Yeah, I just want to say thanks if you've lasted this long. I really appreciate it. I really do. I hope that you follow me on Instagram, and I hope that you have a great day.
Well, we really appreciate your insight. We can definitely get you back on for part 2 of this, and keep listening and following your journey. We'll follow you on social media, and we'll see where you start to go. So thank you so much for joining us, Britany.
Awesome. Thank you for having me.
And for all the Bridge Dental Podcast listeners, hope you enjoyed today's episode, brought to you by none other, your resident dentist financial advisor, Steve Kuza. And we're signing off. Till next time, we'll talk to you soon.